the clavicle. What would we say the clavicle was for? What's its job? We called it a blank.
Oh, a strut.
A strut. Okay, good. For stabilization, for muscle attachment, and giving contour to the thoracic inlet. Okay? So in terms of palpation, really what we want to do is we want to find the medial end of that, which articulates with our meningeal right here. And we found the suprasternal notch when we did our sternum, right? The walls of that are just this right here. Okay, so we'll palpate that. And we'll try to palpate it along its length all the way out here till we feel it, most of us resting on top of the acromion right here. And that's a joint. Okay, that's the acromioclavicular joint. So we want to be able to palpate that, especially since next semester we're going to do tests, special tests, where we compress and see if there's a complaint of pain. And if they localize it right over that spot there, then we've got a positive sign for one of our orthopedic specialists. Fair enough?
Yes.
Okay. So this is really easy, really straightforward to palpate. So we're just going to start with that one. And then everybody will get all happy and we'll move on to the scapula. Okay? So let's have somebody go ahead and either sit or lie down, doesn't matter. Okay, good. So we can have her go ahead and lie down. And sometimes sitting is better. Sometimes laying down is better. Lean folks, a lot of times, it doesn't matter what we do. We can see their clavicles from clear across the room. Never even have to touch them necessarily. Can I just bring this on just a tad? Okay, very good. Now, looky there. Isn't that nice? We see the entire contour of her clavicle just looking. Okay, but what we want to do is then we want to appreciate its borders. So I want us to use our fingers and come down so that we actually feel the inferior border, the anterior surface of the clavicle, all the way out here. See the bump right there? That's the distal end. That's her acromial end of her clavicle right there. I'm going to palpate and appreciate the borders of that as well. What you're going to feel as you do that is that there's also some hard bridging structures right in here. Those are ligaments that are holding the clavicle to the acromion. We're going to be able to feel those as well. If we're paying attention, I can feel one right there. If we're paying attention to what we're feeling, I want you to start feeling those kinds of things now as we go along. Bless you.
That was so dainty.
So does the acromion go, is it more lateral to the...
Yeah, well, we're going to palpate the acromion in a minute. It's clear out here.
Okay.
I'm going to find the anterior, posterior borders of that and everything intervening. So this falls short of that, so it's more lateral. Okay? Just like you said. Okay. So I come in here like this. Once again, we've got this nice big muscle right here that's what?
Sternocleidomastoid.
So if it's activated, if she were sitting up, for instance, we might have a hard time feeling all the way through here. And some of you, it's not an issue. So we like that. She's laying down. We come along like this and feel the proximal end right here, the medial end, or the sternal end. All those are appropriate. And just feel like that. We usually palpate both sides to check symmetry, for instance, injury to one side versus the other, localizing pain from one side versus the other, and so forth. That's a very easy palpation. I want you to be able to palpate it through its entire length. For some of you, this won't be such a big bump. It'll be more flattened. There's actually a concavity in your acromion that accepts that. It's hard to find in some of you. But for the most part, we should be able to feel that from here all the way to its end. Okay? Questions? Break.